What about the food? What about the contamination? Mixed messages coming from the federal government about, well, it wasn't really that lettuce, or it wasn't this, or it was that. And once again, it doesn't seem like we're getting a clear picture about what we're dealing with so that we can protect ourselves and our loved ones and our families. And so we're very honored to have on with us right now Dr. Tyler Evans. He was the former medical officer, I should say, not examiner, chief medical officer for the city during the COVID-19 crisis. He's currently the CEO of Wellness Equity Alliance, which is trying to bring equity in healthcare to under-resourced communities across the United States. And Dr. Evans, thank you so much for being with us. We really appreciate it.
Thanks for having me, Lisa. I do examine people, sometimes systems, every once in a while, so examiner's not wrong.
Okay. All right. I wanted to ask you, first of all, what is this am I saying it the right way, cyclospora, or is it?
So the bug, the parasite, is Cyclospora. The disease is cyclosporiasis.
Okay. And why do you think we're seeing a spike in this right now?
Zooming out, what is it? Cyclospora is a parasite. There you go on your screen.
Right.
That's what you see in your microscope. So there's five, in terms of microbes, there's five different buckets. Bacteria, viruses, worms, fungus, and then parasites. So this is a parasite. We have seen outbreaks that do take place on a fairly regular basis. Unfortunately, we tend to see outbreaks typically every few years. The last major outbreak took place in 2020. Prior to that, 2013 was the largest outbreak on record. This one's very different. This is unprecedented. Just for sort of for reference, when we do have those outbreaks, maybe there's a few hundred cases. The largest on record was less than 1,000. This one's at 11,500. The numbers keep changing, but 11,500 last time that we checked. That's not all laboratory confirmed. So there's a lot of those suspected or probable cases, but this is pretty significant. And now the good news is for New Yorkers is that the majority of these are taking place in the Midwest. So over 60% are in the state of Michigan, but there are a number of cases also in New York. I believe there was about 400 cases that are suspected at this point.
But Dr. Evans, the thing is, in terms of where it comes from, like where does it come from? Because we heard there was a particular brand of lettuce. There were don't go to Taco Bell, or don't, which they said they lost a lot of business, people that were afraid to go there and get sick. How do you know if it's you have this or you have something that's, just like a really bad stomach bug or maybe mild case of food poisoning?
Well, from a dietary standpoint, I mean, I hate to burst anyone's bubbles, but Taco Bell is just generally not a good decision. But from a public health, from a sanitation, sort of microbial standpoint, right now it seems like Taco Bell has removed their connection to Taylor Farms and recalled basically anything that they were using for that. So why this particular, what caused this particular outbreak? It's really a few different things. The Taylor Farms piece, even though there was this false positive that was ultimately negated. From an epidemiological standpoint, that means from an observational standpoint, there were enough cases that do support that it was connected to this Taylor Farms. So that means that a lot of the lettuce, the leafy greens, were coming from Central America. Apparently, there was a mass sort of fecal contamination of these farms in Latin America, and that led to this. So that was one. But there are actually, right now, there's at least 5 different sources of Cyclospora, of the Cyclospora outbreak. So it's not just that one. It is a mass accelerator. The second component here, climate. This is one of the hottest summers. Climate change is a real thing. This is one of the hottest summers on record. I was just in New York, 2 weeks ago. It was 102 degrees. So this is how this parasite thrives, right? It really thrives during May to August. So this too will pass. The numbers keep increasing, but the good news is as the summer starts to cool off, the parasite will ultimately not be able to thrive. But we got to get ahead of this thing. And, a lot of cities and states are working on this, and they're working on this aggressively. But here's the question: why do we continue to have these outbreaks, and why are we currently at this scale? I can pause there and see if you want me to answer that.
Well, let me ask you, but I'm still confused about, is it just this particular brand of lettuce? Is there something about lettuce because it's not properly washed, or it's hard to wash it and then completely dry it before you eat it and all of that? Or, I mean, I don't know. Is it something about lettuce, or are there other foods we need to be careful about as well?
There are other foods. It's not just lettuce. It's leafy greens. There could be some berries. It's produce basically. So it's not just lettuce. Like I was saying before, this Taylor Farms lettuce was one of multiple sources of this current outbreak. So I just want to be clear on that. That was only one. So there are multiple sources. There's a more recent outbreak that we're still investigating. What actually sort of, what was the source of that one? But there's a number of different. So this is creating a sort of perfect storm of conditions as to why we're having this current number of over 11,000. So it's not just Taylor Farms. There's multiple. It's the heat. It's the fact that we from a regulatory standpoint, we are not screening produce in the way that we should. Part of the reason has been the defunding of a number of FDA positions, the defunding of CDC's ability to do surveillance and response, the defunding of a number of state and city and county health departments. So public health is really under attack, and that makes it harder for us to do our jobs.
All right, and then so what is your advice to people in terms of trying to prevent themselves from getting this? Can you give us some tips?
Sure. So I like to put people into three different sort of groups of risk. So in terms of the lowest risk, healthy adults, people without any sort of chronic diseases. And if we have that, and the state or city or county, the area has a relatively low number of cases, then you're in that low risk group. For those folks, in everything in life, there's a risk reward ratio, right? So I would say be informed, understand what what you may or may not be sort of exposed to, but go ahead and eat your veggies. We need veggies, so go ahead and eat them, but just be mindful and make sure that you're connected to a primary care provider.
And then,
Number two.
oh, go ahead.
In terms of medium risk, right? So if you have a few chronic health conditions, could be diabetes, something else that impacts your immunity, your immune system's ability to respond to this. By the way, cyclosporiasis was classically correlated with HIV. So I'm an HIV doctor, and so we've been seeing this for decades. When the immune system is really under attack, we lack the ability to mount that immune response, and that makes it more challenging to fight off the parasite. So in that medium sort of level for just a few chronic health conditions or an epidemiological sort of profile where there's like a sufficient number of cases, I would say, peel it, boil it, cook it, or leave it alone. And so, again, be informed, but take extra precautions. Again, make sure that you're connected to primary care provider. Number three, the highest level of risk. If you are in some of the Midwestern states, Michigan, Ohio, West Virginia, I would make sure that you probably should not be eating any vegetables. Certainly nothing that was connected to the Taylor Farms scenario. Or if you have certain risk factors, individual risk factors like cancer, like HIV, like advanced diabetes, that again impact your immunity, or people over the age of 65 or young children, probably under the age of 18 months. Then I would remove them from vegetables and just have to just wait this out and see how it goes. Again, the good news is this after the summer months go down around September, a lot of these cases will subside. Right now, there's a delayed effect, so this number could continue to rise. But city, county, and state health departments are really responding to this aggressively, and I do think that we will turn the tide within the next few weeks. But there's going to be a delayed effect there.
All right, we just have you for another minute or two, but let me ask you that what you've dealt with infectious diseases and the spread and all the public health efforts made to mitigate them and to get rid of them. But in terms of this Legionnaire's disease, last summer I was in Harlem where the outbreak was in Harlem, and then it was almost like a redo this summer only on the Upper East Side with these cooling towers, people in the community were like, why aren't we hearing about this? Why don't we know which buildings are affected? Why don't we know how we get it? But, that people got the message, okay, it's not contagious from one person to another person, but is it really water vapor that's coming from something that might be 10, 15, 20 stories higher, above the street, and you're just walking down and water vapor gets to you? Or, there was a man that died here who had basically been in his apartment and then passed away from it. But what can you tell us about that we need to know very quickly?
Sure. In the quickest version, the connection between Legionnaire's disease and cyclosporiasis is that they cannot be spread from human to human. Okay, so that's an important point. It is really scary though, because if folks are kind of trapped in their apartment buildings, by trapped, I mean, it's hot outside, they want to
Right.
stay inside in the air. The fact is that's a risk factor, right? It's the vaporization of some of these cooling towers or systems that leads to it. Legionnaire's disease was originally identified in the 1970s because of this conference that was going on in Philadelphia. And so every outbreak that takes place is connected to that, not human to human. Now, you just mentioned it, that almost all of the outbreaks that have taken place in New York City have been particularly among Black and Brown communities.
Right.
Almost all communities have been. It's Harlem and Bronx sort of all the time. That's where I spend most of my time, addressing sort of some of the needs. But this one's different, obviously, in the Upper East Side, one of the most affluent neighborhoods. You've got some of the most
In the
famous
country.
museums that are current.
Right.
Yeah, in the country. So yeah, no, I mean, the good news is the city is doing a great job. They're really responding to this aggressively. It's hard though. It's hard to really control these things. We have a lot of pre-war buildings that the way that their systems were set up, it's hard to do kind of microbial surveillance. I think our ability to do surveillance will change as a result of this current outbreak. But again, under these sort of, these federal constraints right now, lack of funding or whatnot, it's hard for the cities, counties, states to do their job.
But
Again,
can you
the good
really
news
get
is
it from just walking down the sidewalk and then like a drop, like a vapor droplets hit you or something?
No. So that's risk communication, really important. No, this is really, you really have to have sufficient exposure within, being essentially within the building or within the museum or whatnot. It's very unlikely if somebody were at the Met or the Guggenheim for them to be sort of exposed for too long. But again, the folks that we have to worry about the most are the ones, again, getting back to the cyclosporiasis, are the older adults, people with chronic health conditions that put them at risk. Chronic pulmonary diseases like COPD. Those are the ones that we really have to sort of protect. There is an antibiotic for this. I didn't say this before, cyclosporiasis. There's an antibiotic, which is usually for bacteria, even though that's a parasite. This is a bacteria. Legionella is a bacteria.
So antibiotics will work if you need to get treated. All right, Dr.
Testing.
Okay, no, very important. Exactly. Dr. Tyler Evans, thank you so much for being with us. We really appreciate it. Thank you for breaking that all down for us. Dr. Tyler Evans, former Chief Medical Officer for New York City and also CEO of the Wellness Equity Alliance. Thanks so much for being with us for this edition of Newsroom Live.